Hi everyone, I'm Aggi Kozlowska. I'm an osteopathic practitioner with almost a decade of experience. I'm also a kinesiologist, registered kinesiologist with almost 2 decades of experience. And today I would like to talk about low back injury. Why? Well, I've injured my low back this morning. In fact, I re-injured it. And I thought to myself, I can't really go and see any therapist. I can't see my colleagues for a treatment. There might be more people who hurt their backs and are in the same situation as myself. Due to COVID-19, we're not really able to see people who could help us with low back pain or low back injuries. So what do? I've decided to make this video. Not quite ready. My hair looks probably a little bit crazy. I have braces on, but I want to help. So give me a little bit of a break. I've never done this before, but I really want to tell you what are the steps when you just hurt your back. How did I do it? I was actually leaning forward, reaching for something. I just woke up. I was actually not warmed up, clearly. I just woke up and I already had a little bit of tightness in my low back from the last few days. Being stuck at home, I have been working out quite a bit, and I've also been going for long walks. What I have not been doing enough is stretchings. My hamstrings are quite tight actually, and I do have pre-existing low back condition, meaning nothing crazy. I did deal with chronic low back pain about 10 years ago. It's a lot better now, but it is my weak spot, which clearly I did not take care of. So what do we do when we just hurt it? The mechanism of injury for me this morning was flexion, meaning I leaned forward and I curled my back too much and too fast. When that happens to you and you feel that click or that tightness or that moment when you know something just went wrong, you actually want to slowly come back up and move into the opposite direction, meaning you want to reverse the mechanism of an injury. And that's what I did. So I overstretched my muscles. I may have bulging disc. I may have some facet injury. I might throw all these names. It doesn't matter. The point is I hurt it by going forward, and now I need to go into opposite direction to relax my muscles. So I'm going from overstretching to relaxing. That's what you want to do. You want to come up fairly slowly. Obviously, you don't want to fall over. You don't want to lose your balance. And you want to go into so-called extension. It's a position where you have that curvature of that kind of dip in your low back and stay there ideally for a breath or two, which I did. You want to then come back up into, I call it neutral. So not too extended, not too curled, but kind of in the middle. And see how do you feel? Where do you feel this pain? In fact, I move my back around a little bit from side to side, back and forth, and I was looking for a place where I hurt the least. At the same time, I discovered what hurt the most, which I already knew. It was that leaning forward. It was that curling of that low back. So once again, I've decided I'm going to spend my day being more in extension because I want to relax my muscles. I don't want to keep on going and looking for that pain because I might just find it. I might keep on re-injuring or putting my body in a position where my brain gonna detect, wow, something's happening again, I better tighten up. So the point being here is, wherever you hurt your back leaning forward, you want to actually come back and slowly lean into opposite direction or find a spot of least resistance or least pain. I'm not diagnosing here. I'm just suggesting what do we do when we hurt ourselves. Sometimes my patients ask, how do I spend my day? What's best? Do I sit down? Do I lay down? What do I do? Again, I'm gonna say, find a position that hurts the least. However, if you want to sit down, this is what you do. I have my chair here, so I'm gonna show. So first of all, I'm gonna slowly sit down and I'm gonna look again what hurts the most, what hurts the least. In this situation, when I stay in my extension, I actually feel pretty good. In fact, I can knock it down to maybe 0 to 1 out of 10. However, When I curl, when I tilt my pelvis, I'm actually starting to hurt quite a bit. It shoots up to 3 to 4 out of 10. Again, nothing crazy, but there's the difference. So what I would do if I want to watch a movie right now, or have dinner, or just chill out, basically, I would find a place where I can sit and stay. I would probably put some pillows behind my back. I would keep my knees slightly below my hips, level of my hips, or at the level of my hips, because I'm going to maintain that slight arch in my back. Or I would just keep them down, find a pillow, and stay there. This is a place when I hear the least, and I can really actually relax, meaning I'm not tense up through my upper body. I'm not tense up from my pelvis. I can hang out here for a bit. You do want to get up every so often. You don't want to really sit like that for a number of hours. You want to get up and get things moving, improve your circulation, get a little bit of mobility, and let the back muscles relax. However, if it's not possible, if it really, really hurts, the rule of thumb is find a position that hurts the least and stay there. Next, I'm going to talk about some of the stretches and exercises we may do when we hurt our low back. Thank you.